Hello friends. Today I am sharing some insights on the condition asthma, and I will be discussing some important remedies for this condition and its key features. The fundamental law of homeopathy is holism, which means to prescribe on the individual as a whole. Today I am going to share certain keynotes of the condition asthma. One should use these keynotes as an entry point to understand the human as a whole. So one should take these as hints and see if they match to the patient in general. Then the result will be much more long lasting and help to annihilate the disease permanently, as it is termed. The keynotes I have taken are from reliable source from Dr. Vasillis Ghegas, who is an ardent follower of Professor George Vitholkaus. If a patient comes and says that his asthma gets worse in a warm room, top two remedies one can think of is Kali Sulph and Pulsatilla. If the patient says that the asthma is worse from 2 to 4 am and the patient is hot and cannot tolerate warm things, then you can think of Kali Nitricum. If the asthma is worse again 2 to 4 am, but the patient cannot tolerate cold, then we can think of Kali Ars. Asthma is worse from 2 to 4 am in a patient who cannot tolerate cold and becomes blue easily and is restless and anxious. Think of arsenic album. Asthma worse 2 to 4 am in a person who cannot tolerate cold and feels better in a sitting position. Think of Kali Carb. And asthma worse from 2 to 4 am with profuse sweating. You can think of Sambucus. All these symptoms are indicators for us to see whether the patient as a whole matches with the remedy. These are kind of clues for us to check for the other symptoms of the case which can be covered by the remedy. It would be a disaster to just prescribe on single symptoms. So take these clues as only entry points to the case. Now let us study some important remedies with 2 to 4 am aggravation. 2 to 4 am is typical of Kali salts. Based on the pathology, time modality, and thermals of the case, we can narrow down our search to certain remedies if rest of the symptoms agree. Suppose the patient has 2 to 4 am aggravation with stomach troubles and cannot tolerate cold, we can think of Kali Carb. 2 to 4 am aggravation with stomach troubles, but the patient is hot, then think of Kali Sulph and Kali Nitricum. 2 to 4 am aggravation with asthma and cold, intolerable, think of Kali Ars. 2 to 4 am aggravation with asthma in a person who cannot tolerate heat, Kali Nitricum, Kali Sulph. 2 to 4 am aggravation with either a thyroid problem or a skin problem or a headache and cannot tolerate heat, we can think of Kali Iode. These are just random thoughts on 2 to 4 am aggravating modality. I hope this helps my fellow colleagues to think of a particular remedy and confirm if the other symptoms agree with the case. See you soon with more clinical and practical tips for successful practice. Wishing you all a very happy Dashera. Bye bye for now. Thank you.